and Johns Hopkins greats Dr. William Henry Welch and Dr. William Osler. And he worked alongside some of the most influential leaders of the century, Theodore Roosevelt, William Howard Taft, and Secretary of War Elihu Root, who helped elevate the United States to a position of international power and influence in the early 20th century. Gorgas is best known for his yellow fever work. In fact, it was a continuous thread in his life. His parents met during a yellow fever epidemic in Alabama, and a close medical school friend died in the epidemic of 1878. He met his wife, Marie, during another outbreak epidemic in Texas, and soon became one of the Army's experts on yellow fever in the 1880s and 1890s. 2 crumbling leather notebooks in which he recorded the hundreds of yellow fever cases he treated in Havana during 1899 and 1900 after the Spanish-American-Cuban War testify to the suffering and death he witnessed from the disease. In 1901, however, he helped prove the U.S. Army Yellow Fever Commission's discovery that the Aedes aegypti mosquito transmitted yellow fever by clearing Havana of mosquitoes and, to the surprise of most, banishing the deadly disease from that city. Gorgas then took that knowledge and expertise to Panama to make it safe enough for American and West Indian workers to construct the most ambitious engineering project the world had ever seen. In recognition of Gorgas's accomplishments, President Woodrow Wilson appointed him Army Surgeon General in 1914, just months before the outbreak of World War I, 1914 to 1918, and over the next 4 years, Gorgas presided over the greatest expansion of the Army Medical Service in U.S. history. He continued to fight yellow fever throughout his career and, after retiring from the Army Medical Corps, died on his way to investigate the disease in West Africa. Gorgas was not a saint or a man to emulate in all things. He was a white supremacist, born into a patriarchal family that held people in slavery, and he mourned the lost cause of the Confederacy. A leader in controlling tropical diseases, Gorgas did his work to a large degree in the interest of advancing white American imperialism and dominance overseas. His most famous speech was entitled "The Conquest of the Tropics for the White Race." Yet, as a physician, he cared for all kinds of people. His patients included white soldiers and Lakota Indians in the Dakotas, American engineers, and West Indian canal workers in Panama, residents of the pestilent cities of Guayaquil, Ecuador, and Lima, Peru, and black miners in South Africa and Rhodesia. Gorgas's views on race, class, and nation were more nuanced than those of many of his contemporaries. He was a son of Alabama, but married a Northerner and chose New York City as his home. He wore the blue uniform of the U.S. Army, but pinned on his chest the Confederate cross given to him by his mother. A lifelong Democrat, he nevertheless admired Republican Theodore Roosevelt, supported populist William Jennings Bryan, and espoused the views of Henry George, the popular reformer who advocated taxing the rich to improve living and working conditions for laborers. As the Army Surgeon General, Gorgas maintained the white male character of the Medical Corps and helped to perpetuate a profoundly segregated society. Yet he was also responsible for the health of the 4 million soldiers of all backgrounds during World War I, and understood that good public health, like disease, does not follow the color line. Clean water and air, vaccines, safe food, and good hospitals can, if properly deployed, benefit everyone. And finally, while Gorgas prided himself on being a responsible physician and officer devoted to his duty and his country, at times his zeal for fighting disease and mosquitoes caused him to neglect those obligations. William Gorgas thus forged his own path across the landscape of region and race, war and disease, and lived purposefully, seizing every opportunity to carry new public health measures and education to populations in the United States and abroad. In this work, he faced skeptical government officials and hostile business leaders, as well as